Welcome to VisionCenter's podcast, where we dive into the captivating world of eye care and vision health. I'm your host, Alex, alongside my co-host, Jordan. Each episode, we explore the fascinating realm of vision, bringing you expert insights, the latest advancements in the field, and actionable advice to take care of your sight. So sit back, relax, and let's open our eyes to the world of vision. Welcome back to VisionCenter's podcast, everyone. Today, we have a special treat as we dive into a topic that affects many of us, dry eyes. With us to discuss all things related to dry eye syndrome is Jordan, a seasoned expert in the field of eye care. Jordan, thanks for being here.
Pleasure to be here, Alex. Looking forward to shedding some light on this surprisingly common condition.
Let's start from the basics. Can you explain what exactly dry eye syndrome is?
Of course, dry eye syndrome, or DED as we call it, is a condition where your eyes don't produce enough tears, or the tears they do produce aren't of good quality. Tears are pretty complex. They have 3 layers: oil, water, and mucus. Each layer plays a critical role in keeping our eyes healthy and comfortable.
Interesting. And this, I hear, has various other names too.
Yeah, it's also known as keratoconjunctivitis sicca, lacrimal keratoconjunctivitis, and a few other terms. In fact, there's even a type called LASIK-induced neurotrophic epitheliopathy that can occur post-LASIK surgery.
Who would have thought our tears were so complex? So who usually gets dry eye syndrome, and why?
Well, it's more common as people get older, especially in the 45-54 age bracket. Women tend to experience it more often too, possibly due to hormonal changes like those from pregnancy, menopause, or even oral contraceptives.
That makes a lot of sense. Now, Jordan, what does someone feel if they have dry eyes?
Symptoms can range from feeling like there's something in your eye to redness, inflammation, a burning sensation, and even blurred vision. Some people also find their eyes become unusually watery as the body tries to compensate for dryness.
Those symptoms don't sound pleasant at all. How do doctors diagnose this condition?
Eye care providers usually start by taking a thorough medical history and then perform various tests. They look closely at tear production, tear stability, and they might use dye to reveal issues on the surface of the eye. There's no single test for dry eye syndrome. It's more of a puzzle to assemble.
With all these complexities of diagnosis, what kind of treatments are available?
Treatments range from environmental strategies like using humidifiers to eyelid scrubs and artificial tears. There are also anti-inflammatory eye drops and drugs that affect the immune system for more severe cases. For some, simply tweaking their lifestyle a bit can make a world of difference.
That's quite a variety. Is there any sort of definitive cure for dry eyes?
Unfortunately, no cure yet, but managing the condition and underlying causes can alleviate the symptoms significantly. Sometimes, treating other health issues like arthritis or diabetes helps with dry eye symptoms as well.
Now, let's touch on something more natural. Are there alternative remedies folks can try at home?
Absolutely. Incorporating foods rich in omega-3 fatty acids like fish or flax seeds is beneficial. Staying hydrated is key, and for some, acupuncture has proved helpful. The goal is to support tear production and maintain eye health through natural means.
Before we conclude, any quick advice for our listeners who might be struggling with symptoms of dry eye?
Don't ignore the symptoms. Early treatment can prevent progression. Be conscious of your environment, practice blinking exercises, especially when using screens, and perhaps try some of the natural remedies we discussed. Of course, consult your eye care provider to find a treatment plan that works best for you.
This has been really informative. Thanks so much, Jordan, for taking the time to help us understand dry eye syndrome better.
Glad I could help, Alex. Remember, listeners, take care of those eyes.
And that's a wrap on today's episode. We trust you've learned something valuable. Until next time, keep those eyes healthy and keep tuning in to VisionCenter's podcast. And that wraps up another enlightening episode of VisionCenter's podcast. We hope you've enjoyed our discussion and found some valuable takeaways to help maintain your vision health.